Hey everybody, welcome. This is the Rotary eClub of Silicon Valley, and every week we work to try to make you walk away from our little programs with kind of a sense of, man, there's so much cool in the world. We want you to be inspired to see new ways of serving others. Rotary International is an organization with the motto service above self. Our club, the Rotary eClub of Silicon Valley, is one of 36,000 clubs around the world, 1.2 million members. And these are folks who just want to find a cool way to make their local communities and the global community a better place. To that end, we look for the cool stories wherever we can find them. And this week we found them in the person of Ruth Sanchez. And Ruth is with Project C.U.R.E, the world's largest distributor of donated medical equipment and supplies to resource-limited communities across the globe. And so we are very happy to have Ruth here. Ruth, I am going to pass it over to you. Take it away. We're jazzed to hear your story.
Oh, thank you so much, Rushton. And thank you everyone for inviting me. This is a pleasure and an honor. And I do want to introduce Project C.U.R.E. Project C.U.R.E. has been here in the United States across 7 different chapters since 1987. And so we're doing a lot of delivering health and hope to the world. And I'm going to start with the next page. Okay, here we go. So this is a picture of our warehouse. We're in a microchip building that was donated to us, and there's 40,000 square feet of room to keep the medical equipment, the medical supplies. We get these from hospitals, we get them from private clinics, dental hospitals, hospice, and what you're seeing is equipment that goes to patients, family, and children in over 138 countries. I'm very proud to say I come from the world of American Express, Special Olympics, and now Project C.U.R.E, and we have the highest levels of ratings with GuideStar, Forbes, and Charity Navigator, which is very important when we're out there asking for donations. Here's a map. Here are the locations that we are in. Our headquarters is in Denver, and then Phoenix, the Phoenix chapter was created shortly after, but we serve about 200 40-foot containers from all of these different states. Again, we are procuring from manufacturers. We have a great partnership with Stryker. Stryker was able to donate 20,000 COVID relief ICU beds. And with that, they did that kind of later into 2020. We've been able to ship probably 90% of those beds to many countries in Africa. We're working on a string shoe budget. We don't have a lot of staff because we are focused on making sure whatever donations we get, that we get to send that critical need abroad. And so we really rely on volunteers. We're starting to open back up from the COVID pandemic, and we're bringing groups in, churches, students to come in, and we were prior to COVID, we were able to bring in a couple thousand volunteers to C.U.R.E because we're getting donations. Now the donations are a lot of the PPE that hospitals had requested, and they can't store it, so they're giving it to us. Gowns, syringes, they're giving us the mask, the oxygen cylinders, ventilators, things that really, like in India right now, we're focused on India because of the critical nature that COVID has taken a grip on that country. So they're needing everything PPE, and we're able to do that with our volunteers. Like I said, in our fiscal year, which is May 2020 to May 2021, we were able to ship close to 200 containers. They're 40-foot containers to 35 countries. And here's the interesting thing. My boss was asking, right when the pandemic hit, are we going to be able to still ship containers? And I said, of course, because if the need was great before COVID, it's 10 times greater during COVID. And that's why we hit those numbers. So they're record numbers, and we're on point now for the next fiscal to surpass the 200. We got companies coming in, Newmont, Chevron, other multinational companies that want to give back, especially in the areas that they're doing their work in. These containers here are specific to my Arizona projects. And if you can, you just take a look, they're all areas that they're having a really urgent crisis, especially with COVID. We're doing work with Myanmar and Bangladesh, and we're trying to get containers to hospitals along the borders of Myanmar, Bangladesh, Thailand, and India. Myanmar, what's going on in the Myanmar world with the military coup. So a lot of the citizens have fled to the areas of their borders. And that's why, the need is great there. So we're talking with a few companies that are stepping up to the plate and getting that done. These are all my containers. I can, anybody wants to, have another call at some other time. These I know very personally, very intimately. And as tragic as many of these are, like South Sudan, this is being sponsored, one container to a very remote part of South Sudan. She lost her husband and her 2 children to in the war. And so these are near and dear to my heart. And we're working on raising funds and getting procurement of, equipment. These are photos. I always feel like photos tell the story. And this one is in Central America. And when we say it does take a village, it absolutely does. You see the community coming together and unloading into the clinics. Sometimes these containers can be for one hospital. Sometimes they can be for 5 clinics. And the way we separate and identify what clinics go to what area, they're all color coded. And so the truck obviously is there to unload for this clinic. It looks like it could be for a couple of clinics, but this is what that looks like when the village is engaged. This is in Africa. They're unloading probably the color coded green, because I see green, to this clinic. And these are consumables, obviously. These containers can include beds, they can include anesthesia units, ventilators, and then the hard equipment like the wheelchairs, the IV poles. We hear stories of people are holding their own IV bag because there's no poles. Again, the village involved, and it looks like some Project C.U.R.E. Boots on the ground are there to help. This is really an important screen, because if you think about it, I had surgery 10 months ago, and my surgeon had 2, sanitized plates of all the equipment they're going to need, the tools. They're not so much. And so when we procure tools, we make sure they're sanitized, and then we also send autoclaves. So we put the kits together based on surgical nurses' list. We even make sure that it's the right suture, and we create kits for places that don't have kits. I was in Nigeria, and all of their tools that they were going to reuse were in a vat of water. So that's not going to sterilize anything. These are our programs. Kids for Kids, I just talked to Microchip. We're in a building that they donated, and they're going to bring in their new staff. Their onboarding process is to get you know, them engaged in making sure that we're getting kits for kids. These are, you know, basically medical kits for what you and I have in our bathrooms. That's what that includes. Sorry, I'm going backwards here. Now I'm going forwards. You can see a couple years ago, we delivered over 7,000 kits to 27 countries, and they're listed here. You see the kids, they get to use this as backpacks when they're done. C.U.R.E kits, they're very popular, probably will be more popular as COVID, just starts decreasing. These are C.U.R.E kits, a lot of mission trips, missionaries take these, send them, they're already TSA approved with all the custom letters, and we get them into countries. And they have everything that a clinic would need, like a small clinic. We partner with USAID. We work with Merck for Mothers. We want to make sure that we're also providing training and not just equipment to make sure that that's being utilized, and that our goal is to reduce mortality rates by 50%. Helping babies breathe, the golden minute, the first 60 seconds of their lives. We train midwives, we train nurses, how to make sure that that infant survives that golden minute. And they're obviously in distress when they've been born. C.U.R.E clinics, we work with a lot of different groups, and this one is where we have 7 trips a year, and we're going to get back to this, where volunteers can come and help up with pop-up clinics. You can see prior to COVID, we had more than 10,500 patients in 7 countries be seen. And some of these have never been seen before. Some more photos, Central America, Africa. And then, I in communication with Rushton, it's always been, what is the intent? What do you want? What do you need from us? And of course, how can you get involved? So, we are always requesting for donations towards containers, engage with C.U.R.E Kids or Kids for Kids, event participation. If you go to our website, projectcure.org, you'll see where we have events, and refer us to opportunities for procurement. You can sign up for C.U.R.E clinics, and we are always looking for volunteers and companies to come on board with us, walk alongside us. And so I think I'm kind of between that time frame I was given. So I'm so glad that I was able to share just a little bit of what we do.
Fantastic, Ruth. Thank you very much for the time that you put into this and the chance to share this story with our group. I know we've got some questions. Let me first introduce the folks that we've got in our group. And so all of you who are on the call, I'll mention, feel free to wave at the camera. We have here in the Bay Area, we have Sandy, we have Raj, we have Shags, we have Chris, who is on his way to being a member. Way to go. By the time this airs, by the way, he will be, so all good. In Houston, we've got Rory. Good to see you, sir. Very impressive shirt, as we were discussing before. And of course, my name is Rushton. My name is Rushton. And Ruth, we are really, really happy to be able to share this story with others. We're going to start with Raj. He has the first question for the group. So Raj, if you'll unmute, go ahead.
Hi, Ruth. My question is around both like the demand, what people are asking for the most, and supply, just out of curiosity, what is offered the most. So is there a disconnect between that? Are you able to sometimes convert what is easily available here into the supplies you need? Maybe you can talk a little bit first about what supply is needed most.
I think thank you. That's a really good question. The biggest request is biomedical equipment, the anesthesia unit, the ultrasounds, and depending on where what warehouse has it, most of the time they're in Houston, because Houston is double hospitals and they're connected to manufacturers. So we're able to give, and it's a 50, it is a 60-40 split in a container, you could have 40% bio, and then the rest is consumables, beds, wheelchairs, walkers, IVs. And I would say probably 90% we're able to fulfill what that need is. Now, if we get a partner that says, no, I want 80% bio, we're probably going to have them do another container. And we do assessments, so it's not like, they come up, here's our list. Absolutely, we want to see the list, but I've assessed probably 12 hospitals in 4 different countries in Africa, and sometimes what they're asking for isn't what they're going to be needing. So we have to really drill down to what that need is, but I would have to say 95% of our partners are very happy. Now with India, that did end up being a challenge because they really needed anything oxygen. And so we were able to send all of our oxygen cylinder tanks and our ventilators to probably 5 different hospitals, but that didn't meet the need of the smaller clinics. So that was frustrating. Now they're still in line as we, in America start donating those back to us. So we're starting to build that up. And as we're shipping that out. Good question.
Well, thanks, Raj. Sandy, you have a question.
Hi, thank you so much for your presentation. It's wonderful work that you do. My question is there any restrictions on what people can ask for, or do they have to qualify in any way? So, let's just say I have a nonprofit and I'm planning on going on a trip to, Myanmar. And, is there any qualifications, I guess, is my question.
Or
say we want to bring stethoscopes and, blood pressure machines or something like that, just real basic.
Yeah, there's none, because that's what's in our C.U.R.E kits, those big green bags. They're not, and because it's humanitarian and we're providing all of our NGO and because we're also an NGO, that gets us through the countries. And I would have to say about, 90%. We have the relationship with the government.
Thank you.
Mm-hmm.
So a question that came in from the chat has to do with the cost of a container. So you gather all of the donated equipment, you ship it. I assume that you are also raising funds for those transportation costs.
Yes. So there's probably, every country it's different, because here on this continent, it's obviously a little less expensive because we do a lot of containers to Mexico, and it's right across our border. Now, so there's an emergency relief container that's $13,500. What's in it is free because it's donated to us. So, and most of those are consumables, beds, no biomed, because we don't do an assessment on emergency. It's an emergency. We need to get what their needs are. And then there's E.R.B containers that's just 100 beds, brand new, and that could be, $150,000 worth of beds. I'm just throwing that out there. I'm pretty sure it's a lot more, but for E.R.Bs, no matter where it goes, on the water, that's $21,500. And again, that's also for the rental of the containers. Those containers used to be a rental cost of $4,000. They're now $6,000 because there's a shortage. And it doesn't help when we have a huge ship stuck in I think it was the Suez Canal. And then, right? And then I would have to say about 21, 23, that includes the assessment that makes sure that the person that flies out there, their travel is covered. And we get fundraising. We get a church that will say, we're gonna raise the funds in 2 months. I do fundraisers. We have fundraising links. We have foundations that want to give grants that are very specific to, pediatrics, maternal, a certain focus. And then I have an ambassador board of 100 of my top donors here in Arizona that I know very well. And I know right now, Mr. Dada is wanting to do a couple of containers of E.R.B beds to Guatemala. And we also are doing a pitch to Dutch Rose that does a lot of work in El Salvador, and the embassy is asking for containers. So we try to do a lot of matching, gift matching. So I hope that answered the question.
Great stuff. Speaking of the groups raising money for you, you talked a little bit at one point about volunteer groups getting together to help make things happen. So not necessarily the groups that travel, but the groups that are here. Does that only happen in the communities you identified on the map? In that one slide that said, that had about a half dozen or so communities identified, or does that happen in other places as well?
So you're talking about the 7 places that we have chapters in, right?
Right.
Yeah, it's only at these because we have the warehouses, we get the donations here.
Got it. Okay. So I'm gonna finish with a personal question for you. I know that before you joined Project C.U.R.E, you were with Special Olympics, and so that's an organization that's near and dear to my heart. But I'm curious what kinds of things you see as overlap between your work with Special Olympics and your work with Project C.U.R.E.
Well, that's a really good question because it's a very profound purpose. My son is special needs and he's in his 30s. And so to me, when he was competing, and he has very high self-esteem, I mean, this kid is on top of everything. And I believe it came through Special Olympics. And I've always had a very a soft heart for the people of Africa, for anyone in need. And I think I've seen the overlap because I'm a fundraiser, is the need for the community and the communities to get involved and to support these nonprofits, because I know a lot of people have big hearts, and if they don't know about us, but they certainly don't want to go travel to a country that they're not sure about. And I hear that from donors all the time. I'm so glad you're here because I want to help, but I don't feel like I can because I don't want to go there, but I want to write a check. Tell me about your projects. And all my projects you saw on the screen are all on my wall. So the need is always the same. It's personal. It's going to people that are, athletes that are going to be benefiting. It's going to be beneficial for a mom who is in a pregnancy that she's not sure about. She's having complications and nobody knows what's going on. And so it's like this need. It's personal to everybody, and it could be different for everybody too. But I just know that whatever that need is, I was going to fill it. And I loved working at Special Olympics Northern California. Loved it.
Ruth, I love that you zeroed in on the opportunity for a community to rally around a cause. That seems to be when people really understand that there is a joy and meaning that comes from helping others when they experience that with people that they work with or study with, things like that. Before we hand it back to you for a final word before we finish the recording, a bit of a message for all of you who are watching this recording. Thank you for joining us. We are always happy to have people from all over the world take part in our little meetings by seeing the different things we offer, from the inspirational video to the learn something new, to the world of Rotary, to all the different pieces that allow you to get a sense of who we are as a community. And we thank you for doing that. We ask that you do 2 things. First, let us know you were here. There is an attendance piece where you can just put in your name and your email address. And if you put in that email address correctly, you'll get an email that you can pass along to your club secretary if you are a Rotarian looking to make up a missed meeting, in order to get all of the pieces there that you need for that. And then additionally, at the bottom of the page, you'll see our forum, Discuss, DISQUS. And there is your opportunity to say a little bit about what you experienced in the meeting, whether it was about this program or some other element of the meeting. We would love to hear from you along those lines. You can reply to others as well. It's one of the ways that our club, distributed around the world, connects with each other to share ideas. As we always like to do, we hand it back to our speaker for a final word. So Ruth, take us home.
Thank you. I hear this from donors How much do you need? How much is needed? What's the cost? What is being sent in the containers? The containers can be anywhere, gift in kind between $250,000 to $750,000. But at the end of the day, I say this: you can't put a price on anybody's life, and you can't do anything if you don't have health. And you know, if we don't have health, we go to the doctor, and we're able to because of insurance. But the people I serve, they don't have that, so it's tough. And so I always tell folks, you know, you can't put a price on anyone's life, and health is everything. And just help us however you can. And we really appreciate it. Thank you. Thank you so much.
Wonderful, Ruth. Thank you. And for all of you who are watching this recording, thank you for joining our meeting, and we will see you next week.